Lead poisoning exposure has detrimental effects, especially to the pregnant mothers, their unborn children. Remember, this hazard to the pregnant mothers can lead even to miscarriage, premature birth, stillbirth, low birth weight, and congenital malformations. The estimates from the World Health Organization indicate that lead poisoning accounts to 0.6% of the global burden of disease and contributes to approximately 600,000 cases of intellectual disability in children annually. These are not just figures. They are figures that could be alarming in the future. There's already a directive about replacing the asbestos sheets across the country. So what are we doing about this? How are we going to take care of while disposing these asbestos? It is important as a ministry, as a community, and as a consortium to be able to come up with solutions. You see, the minister has declared himself. The Ministry of Environment have already declared, but what are we doing about it? Because we must be part and parcel of the solution. It is not just about removing, but there's also that which can harm if they are poorly removed and disposed. We have a duty and an obligation as Kenyans, and therefore as a ministry, we will finalize and validate and disseminate the national policy on sound management of chemicals, lead poisoning prevention advocacy, legislation compliance, and enforcement in partnership with all of you as our key stakeholders and multi-sectoral committee. And equally, as the custodian of public health issues, we will develop the national strategy and action plan for the management of risks associated with exposure to lead poisoning and partnership with key players and everyone else. I have stated there is no point of reinventing the wheel. We must review laws, regulations, guidelines, and strategies to tackle the emerging chemical of environmental and health concerns, including antimicrobial resistance through a One Health approach.